Today I'm going to talk about shoulder dislocations. Hello, I'm Dr. Leon Popovitz. Welcome again. A couple of weeks ago I touched upon it. A study came out about the management of first-time dislocation related to trauma in young patients. But I felt like it didn't really go into enough detail to get a good sense of really what shoulder dislocations are and the different types. For the most part, there are three different types of shoulder dislocations, or three different types of situations where a shoulder will dislocate. The first one is what we discussed before, is a young person having a traumatic dislocation, for example, a fall on the ground, or being tackled during football, or a fall during any kind of a sports activity, or somebody pulling on that shoulder accidentally very hard. That shoulder can dislocate. That usually, the shoulder usually dislocates in a traumatic setting in young people, usually dislocates forward or anterior. And when I talk about young people, it's never an exact age range. But for the most part, situations like this, under the age of 40 is considered relatively young and a high risk for a redislocation. So the studies have shown that when somebody dislocates their shoulder as a result of trauma, usually goes forward, anterior, and it usually results in a recurrent dislocation. And the younger you are, the higher likelihood it is that you will dislocate again. For example, if you're under the age of 20, if you're 18 or 17 years old, and you have a traumatic dislocation, the chances of you dislocating again and recurrently is probably in the mid-90s. So very often the treatment for this, even after one dislocation, the treatment for this is to surgically repair and stabilize the joint. When these sort of things occur, very often something called a Bankart lesion occurs. A Bankart lesion refers to a tear of the labrum, the cartilage that surrounds the rim of the socket portion of the joint in the shoulder. And that labrum tears in the front bottom portion, inferior anterior portion. And that labrum is connected to a very important ligament called the inferior glenohumeral ligament. So when that whole complex occurs, when there's an anterior dislocation, where the shoulder slips out of place towards the front as a result of trauma, it usually rips that labrum, that cartilage rim around the socket portion of the shoulder joint, and that labrum takes the ligaments with it. The tear takes the ligaments with it. So essentially a bare area of bone occurs on the bottom front part of the shoulder. It's been shown when that Bankart lesion is present as a result of trauma in someone very young, the likelihood are that they're going to dislocate again. And if that patient or that person dislocates over and over again, you're going to grind away the articular cartilage, the lining of that joint, and that will lead to premature arthritis, not to mention significant pain and disability. So that's one type of dislocation, traumatic, young person, one direction. The second type is a dislocation that occurs in older people, usually older people, meaning probably 60s and beyond, where someone falls and dislocates their shoulder. The cause of that is usually a rotator cuff tear. So the rotator cuff are the group of tendons that surround the joint, surround the bones in the shoulder, and is responsible primarily for moving the shoulder around. It also is responsible for stability. Somebody over the age of 60 that has a traumatic dislocation of their shoulder, usually that results in a rotator cuff tear. Somebody under the age of 40 or even 30 having a traumatic dislocation, usually that results in a Bankart lesion, which is a labral and ligament tear. Much like the treatment in a first-time dislocation in a younger person, very often if it results in a rotator cuff tear, same holds true in an older person. If there's a full thickness rotator cuff tear as a result of a dislocation in an older person, typically we recommend operating and fixing that rotator cuff, because very similar, that shoulder is going to be very weak, you're going to have difficulty raising your arm altogether, and that eventually may very well lead to arthritis as well. So you lose function, and you may lead to arthritis. So that's the second type of dislocation. And the third dislocation is something called multi-directional instability or ligamentous laxity. That's in people who have loose joints. A lot of people call it double jointed, people who can bring their elbow very hyperextend or bring their thumb all the way down to the wrist. Or you just may notice that they can dislocate their shoulder on their own at will and relocate. Those people usually have instability in multiple different directions, not just through the front, but usually down below or even towards the back. That's multi-directional. Those patients, we really make an effort to avoid surgery, because those patients, even if you repair or stabilize the joint, because their tissue may become more flexible with time, because their tissue is so flexible, even if we tighten it up, eventually that tissue may loosen up and may continue to have recurrent dislocations. There are some exceptions where the patient has so much instability that they're just suffering so much. Sometimes we can do procedures to stabilize that joint where we cut a piece of bone, we shift it off to the side and create more space and create a bit of a buffer and a bumper. But again, that's not a very common procedure, and we do our best to avoid that procedure if we can. So again, the traumatic dislocations that result in tears, whether it's a younger age group or an older age group, those typically are stabilized surgically. The ones that have dislocations or recurrent dislocations without any trauma, those we try to treat without surgery. I hope this was very informative. I'm Dr. Leon Popovitz. Thank you so much for joining me. See you again soon.